Its body system presentation is over the gastrointestinal system. There are many changes that occur in the gastrointestinal system for the geriatric population. Some of these changes occur in the mouth. Some of these changes are the loss of tooth enamel, which can lead to decay, the receding of gums, which causes inflammation and can cause infection in the gum line, the decline in taste buds, which can lead to anorexia in patients because of their lack of taste, and the decrease in salivation, which often leads to a dry mouth in older patients. Some changes in the esophagus are the slow emptying and sometimes the peristalsis of the esophagus. So when you're younger, you can swallow faster, and whenever you're older, that swallowing mechanism slows down. Some changes in the stomach that occur is decreased motility, which allows the food to sit in your stomach longer, decreased drug metabolism, which can cause the changes in medications that you take, which could ultimately lead to constipation, and also the loss of protective gastric mucus. This is a big issue in the older adult patients or geriatric population because of the use of NSAIDs. It can cause peptic ulcers, which is common in the geriatric population. Intestinal changes that can occur include decreased nutrient absorption and decreased motility, which can ultimately lead to constipation, which is a large problem in the geriatric population. In this slide, it's just covering more in depth about the geriatric gastrointestinal system. And so I've taken a screenshot of table 3.4 that's on page 32 in the textbook Ebersol and Hess Gerontological Nursing and Healthy Aging. So in this, it talks about the mouth and the wear and tear of the teeth, which increases the risk for decay. It also goes into the gums receding, which increases risk for the oral and cardiac disease. It also talks further on the esophagus, which in here it talks about the sluggish and erratic movement of muscles. This can lead to GERD, gastroesophageal reflux disease, which is a common issue rising in the geriatric population. It also talks further about the stomach and the decreased motility and the reduction of the gastric mucus, which ultimately causes ulcers in the stomach. It talks about the intestines and the reduced function of the intestinal villi. The importance of the villi is to absorb nutrients, so the reduction of that causes an increased need for the nutrients in the body. And it also has at the bottom about liver, and that reduces blood flow to the liver as you get older. And that increases the half-life of fat-soluble medications. For geriatric gastrointestinal system, the assessment is pretty much the same as the covered assessment for any gastrointestinal system. So you want to start off by asking questions to the patient about their intake, their appetite, diet, issues, medications. And so questions that you may want to ask is, what is their typical daily food intake? If they take any supplements, if so, what they are. Make sure and ask about how their appetite is, whether they've had any changes recently. Another question to ask is if they've lost or gained any weight recently. If so, you'll want to ask how much weight loss or gain has been occurring. And you want to ask what kind of diet the patient is on, if they're on any type of special diet. Also consider if they're having any difficulty swallowing or if they wear dentures. Another question to ask is if they've had any GI disorders or surgeries in the past. So to move on, it's important to consider the patient's family and genetic history along with the current health problems the patient is having. So there are some disorders that can go through your family, and one of those is diverticulitis. That's a common one that families tend to pass along. Then you'll move on to the abdominal examination, which is the physical examination of the patient. So for this, you're going to start off with inspection. And so whenever you inspect the patient's abdomen, you'll want to look for any type of protrusion, or if their stomach is concave or convex, which can assume a normal weight or possibly an anorexic situation in a patient. After you inspect the patient, you will go on to auscultation. With auscultation, you're going to want to listen in all four quadrants of the patient, the left upper and lower, and the right upper and lower. And during this auscultation, you'll want to listen to whether there are hyperactive, hypoactive, or normal active vowel sounds. Then you'll move on to percussion. Percussion will determine the size of solid organs and detect the presence of masses, fluid, and air. It also estimates the size of the liver and spleen. So you'll listen for tympanic, which is the loud musical sounds, or you'll listen for the dull, which is the medium pitch, softer, thud-like sounds in the abdomen. An important piece of the assessment is laboratory assessments. And so this is the CBC, which will tell you the different levels in your blood of the nutrients that you're getting, the blood counts and serum enzymes, urine test, stool test, and colonoscopies. Colonoscopies, as you age, they recommend that you get them every 5 years once you pass the age of 50. So that is a change that geriatric patients will see in their healthcare. In this slide, I've put a picture of the abdominal region of a patient. I've done this to kind of explain the physical examination of a patient's abdomen. So in the left lower quadrant, you will see a descending colon, sigmoid colon, and ovary and left ureter. In the left upper quadrant, you're looking for the organs of the stomach, spleen, left lobe of the liver, the body of the pancreas, the left kidney and adrenal gland, the splenic fixture of the colon, and parts of the transverse and descending colon. For the right upper quadrant, the organs that you'll look for there are the liver, gallbladder, duodenum, head of the pancreas, right kidney. And for the right lower quadrant, what is there is the cecum, appendix, ascending colon, right ovary, and right ureter. The pathophysiology of the gastrointestinal system of a geriatric patient. So I sum this up in a short paragraph here, but I'm moving on to it in the next slide more in depth. But I said with age, the stomach's lining capacity to resist damage decreases, which in turn may increase the risk for peptic ulcer disease, especially with people who use aspirin and other non-steroidal anti-inflammatory drugs. Also, the rectum enlarges, causing constipation. The strength and tension within the esophageal sphincter occurs and can create esophageal contractions. To go into more depth about the pathophysiology and what issues can occur with geriatric aging for the gastrointestinal system, the first one I have on here is peptic ulcer disease. So as I said earlier, the gastric secretions decrease in the stomach, which causes more irritation with food, which can ultimately lead to peptic ulcer disease, which is a huge issue in the geriatric population. It also talks about atrophic gastritis, and so aging has little effect on the secretions of stomach juices such as acid and pepsid, but conditions that decrease acid secretion such as atrophic gastritis become more common in the older patients. Constipation, which is often caused by overtaking medications or not having enough fiber in your diet. And so often this occurs when patients are on opioid medications for pain, which can cause the constipation. Diverticulosis which is where some foods irritate the stomach lining and can cause pain and irritation in the stomach and intestinal linings. And there are many digestive tract disorders that can come up as aging occurs, just depending on the way that the person ages and how their body reacts to the aging process. So in this slide, I put a little comic in, and I did this because I think it shows what patients really can be understanding from what we are teaching them, rather than the actual information that's getting along. And I think this is important to understand in order to help improve the communication gap that happens between patients and the medical staff. In regards to teaching patients about the geriatric gastrointestinal system, I think one important thing to educate your patients about is educate patients ways to prevent tooth decay and receding gums, such as flossing, dental care, and gentle brushing. This can solve quite a few problems that the elderly patients have with their teeth, with early education about how to prevent these issues. Another thing that is important to educate patients about is about the limited elasticity of their stomach, and recommend frequent small meals rather than fewer large meals. So with elderly patients, you can see how over time they typically thin, and that's because their stomach can't hold as much food as it always has. And so it's important to make sure that there's compensation for the lack of food that they're having as they age. And so small, frequent meals help with that. Another thing to educate patients about is choices that can increase the risk of constipation, such as opioid medication and lack of fiber in diet. With the elderly population or geriatric population, constipation seems to be a big issue with them, and it's often because of a lack of fiber in diet and a consistent take of opioid medications, which can cause issues in constipation. To continue talking about patient education, I think for the gastrointestinal system for geriatric patients, it's important to inform the patient about the decrease in absorption as age increases, and promote the use of vitamins and intake of extra nutrients as recommended by the physician. Since there's decreased absorption, there's often times needed for supplements in the patient's diet. Also, it's important to educate the patient about the importance of routine colonoscopies and laboratory tests in prevention and maintenance of good health. So it's important for geriatric patients to get colonoscopies, and it's recommended every 5 years, which is a new thing for the geriatric population since colonoscopies have not been happening consistently in their lives.